Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is about the human infections that are caused by Erysipelothrix Rhusiopathae. Erysipelothrix Rhusiopathae is a bacterium that can cause infection in the skin as well as in other organs within the body. This bacterium has the ability to withstand various environments, and therefore it can be found in water and on land. While in water, it can infect animals in the water, for example fish, and while on land, it can infect farm animals, for example pigs, turkeys, as well as other animals, including pets. Human beings can get infected by this bacterium when they get exposed to the infected animals or their products, but also if they get in contact with infected soil and water. The bacterium can enter the human body through a scratch or a cut, and it can infect the skin as well as other organs within the body. The individuals that are commonly affected are those that work in animal-related occupations, for example, fishermen and farmers. By the way, remember that 2 billion of the world's population derives its livelihood from agriculture. So this means the significant part of the world's population is exposed to this bacterium. The other group of individuals that are commonly affected includes those with underlying comorbidities, for example, diabetes mellitus, hypertension, alcoholism, individuals that have arthritis. Arthritis, by the way, is the irritation, the inflammation of the joints. Individuals with heart diseases, lung diseases, kidney diseases, liver diseases, individuals with cancers, obesity, anemia, individuals that have sustained an injury to their skin, for example, through a road traffic accident, a piercing, a tattoo, individuals with skin conditions, for example, psoriasis, eczema, substance abusers, smokers, individuals with viral or fungal infections, as well as individuals that have mental illness. However, the bacterium can also infect individuals without any underlying comorbidities. When it comes to the signs and symptoms, there are 3 ways the infection with Erysipelothrix Rhusiopathae can manifest in humans. The first one is the lococutaneous disease, also known as erysipeloid. The second one is the generalized cutaneous disease, and the third one is septicemia. The lococutaneous disease, also known as the erysipeloid disease, is the commonest presentation, and it is characterized by a reddened, swollen patch on the skin that has well-defined raised borders. These lesions are common on the back of the hands and fingers, as well as the feet. There might also be bullae, vesicles. Bullae and vesicles, by the way, are just small swellings that contain clear fluids, but these small swellings can burst and they can be replaced by an ulcer. If you watched my last video, you will notice that this is exactly how erysipelas presents. So this means we cannot rely on clinical diagnosis. We cannot rely on history-taking examination to make a differentiation between erysipeloid and erysipelas. That means we have to rely on laboratory investigations to differentiate between erysipeloid and erysipelas by virtue of the bacteria that will be isolated, that will be identified. That is, Erysipelothrix Rhusiopathae will be identified for erysipeloid, that is the lococutaneous disease, while the group A streptococci, specifically Streptococcus pyogenes, and the non-group A streptococci will be identified for erysipelas. The second presentation is that generalized cutaneous disease, and in this context, the patient will have skin lesions all over the body. They will not only be localized on the back of the hand and the fingers as well as the feet, but they will be all over the skin, all over the body. The third presentation is septicemia, and this is when the bacterium will enter the bloodstream and it will cause signs and symptoms in other systems of the body. For example, in the gastrointestinal tract, that is the system that is responsible for the digestion of food as well as absorption of nutrients into the body, it will cause some presentations, for example, vomiting, nausea. Nausea is when you feel like you want to vomit. Diarrhea, hepatomegaly, that is enlargement of the liver. Ascites, that is fluid accumulating within the abdominal cavity, as well as intra-abdominal abscesses, that is collection of pus in the abdominal cavity. In the urinary tract system, there will also be dysuria, that is pain on urination, hematuria, that is blood in urine. The urine will also smell very bad, and there might also be some proteins in urine. When you go to the hospital and they do a urine analysis, your doctors will tell you that there is some proteins in the urine, which should not be there under normal circumstances, by the way. And finally, there will also be kidney failure. In the respiratory system, the affected individuals will develop cough, respiratory distress, and this will be evidenced by difficulties in breathing very fast. The individuals will also develop some complications, for example, pneumonia, that is infection in the lungs, as well as empyema. Empyema is collection of pus around the lungs. In the cardiovascular system, the affected individuals will develop dyspnea, that is difficulties in breathing. They also develop tachycardia, that is the heart will beat very fast. The affected individuals will also have hypotension, that is a low blood pressure, and they might get syncope, that is they might lose consciousness all of a sudden. The bacterium can also cause damage to the valves of the heart, and this can result into heart failure. There can also be disorders in the blood. For example, the white blood cell count will be high. There will also be anemia, that is a reduction in the concentration of hemoglobin. Hemoglobin, by the way, is a pigment that is responsible for carrying oxygen in the red blood cells. It will also be low. There will also be hyperglycemia, that is an increase in the blood sugar levels. In the musculoskeletal system, we can have arthritis, that is inflammation, irritation of the joints. We can also have myalgia, that is painful muscles. There will also be painful joints, weakness of the limbs, as well as septic arthritis, that is collection of pus in the joints as a result of irritation of the joints that is caused by this bacterium. The affected individuals can also have general signs and symptoms, for example, fevers, chills, general body weakness, general body pains, double vision, altered mental state, weight loss, excessive sweating, loss of appetite, nose bleeding, abscess formation, that is collection of pus within a given part of the body, as well as features of meningitis, for example, a rigged neck, convulsions, and headaches. As you can see, this bacterium presents with a variety of signs and symptoms, and all these signs and symptoms are manifested by other conditions, and this makes the diagnosis of infection with Erysipelothrix Rhusiopathae very difficult without the aid of laboratory investigations. However, please be on the lookout for the skin lesions and involvement of the heart valves, as these two manifestations are very common in the infection with Erysipelothrix Rhusiopathiae. When it comes to the investigations, we can carry out ECG and echo, and this can help us ascertain whether we have any involvement of the heart valves. We can also carry out microbiological culture, and this can be done on tissues or the blood. This can help us ascertain the exact bacteria causing the infection, and in this context, Erysipelothrix Rhusiopathae, as well as the antibiotics to use. We can also employ other techniques, for example, the VTEC2 system. We can also use mass spectrometry. We can as well employ the molecular techniques, for example, PCR, ELISA. All these investigations are aimed at finding out the exact bacterium that is causing the symptoms. In majority of the cases, we can always isolate the bacterium using the microbiological culture, that is using the tissues of the affected areas as well as blood. But in some instances, we cannot isolate the bacterium, so we can use the microbiological culture together with these other techniques that I've talked about, that is the mass spectrometry, VTEC2 system, and the molecular techniques like PCR and ELISA. When it comes to the treatment, some patients can be cured with only antibiotics. However, some patients might need antibiotics and can also benefit from heart valve replacement surgeries, especially if there was involvement of the heart valves. The antibiotics, by the way, are always dictated by the culture and sensitivity. And the antibiotics that we commonly use include the carbapenems, for example, meropenem, imipenem. We can also employ penicillins. We can also employ the cephalosporins, for example, the first generation cephalosporins and the third generation cephalosporins. When it comes to the prevention, please ensure that you exercise good personal hygiene. Always use personal protective equipment, for example, gloves, when you're handling animals. And if you ever sustain any injuries on your body, please show up to the hospital such that these injuries can be cleaned. And if they are deep injuries, let them be sutured. And they should be closed with a sterile dressing until stitch removal has been done. And even after stitch removal, the dressing should continue until after a month from the time of injury, because this can protect the wound from contamination by this bacterium. The take-home message is infection with Erysipelothrix Rhusiopathae requires early diagnosis. Otherwise, the patients can develop life-threatening complications, for example, heart failure and damage to the heart valves. Unfortunately, this infection presents with signs and symptoms as well as complications that are exhibited by other conditions, and this makes a clinical diagnosis more difficult, and so the clinicians have to rely on laboratory investigations. Because of the difficulties in clinical diagnosis, it is really essential that we have a proper laboratory setting where we are able to do the microbiological cultures, the VTEC2 system, the mass spectrometry, as well as the molecular techniques, for example, the ELISA and PCR. Remember that about 2 billion people in the world derive their livelihood from agriculture, and so they get exposed to these animals that might be infected. So it is very important that we always have a high index of suspicion of this infection if the patients are presenting with all these signs and symptoms that I talked about. But among all these signs and symptoms that I laid out earlier, please be on the lookout for the skin lesions that I described, as well as heart valve involvement. That is what I had for you. Thank you so much for watching. Please share my videos and also subscribe. See you in my next video. Bye.